Think about the last time you were, I don't know, walking the dog or finishing up a long shift, and your lower back was just completely aching. Or maybe your knee flared up,
Oh, yeah, we've all been there.
right? And what do you normally do? You probably ice the knee, maybe do some quick back stretches, or just swallow some ibuprofen and call it a day.
Which is exactly what most people do, yeah.
But what if the problem wasn't actually in your back or your knee at all? What if, the actual culprit was trapped right there inside your shoe?
That is the million-dollar question. Because we really tend to treat our bodies like a collection of totally isolated parts. Like, oh, the knee hurts. Treat the knee.
Exactly. But, okay, let's unpack this for a second.
Yeah.
Because if a homeowner spots a diagonal crack in their living room wall, their very first instinct shouldn't be to just, slap some spackle over and paint it.
No, of course not. You check the foundation.
Right, because if the foundation of a house is sinking or if it's misaligned, patching the drywall isn't going to solve the underlying issue.
Mm-hmm.
I mean, the entire structure is compromised.
Yeah, the crack is just a symptom.
Exactly. Yet, when it comes to our bodies, we patch the drywall literally all the time. We completely ignore the fact that the actual foundation of our entire bodily structure, which is our feet, obviously might be completely failing us.
It's basically the textbook definition of treating a symptom while just totally ignoring the root cause.
Mm-hmm.
And, that exact paradigm shift is what our source material today really forces us to confront.
Yeah, it really does.
So today we are looking at the comprehensive practice of Michael L. Ashley. He's a board-certified pedorthist, and he's based in Cedar Hill, Texas, serving the whole best Southwest DFW area.
Which covers places like DeSoto, Lancaster, Duncanville, right?
Yeah, exactly. And his entire clinical philosophy, which is built on over 20 years of clinical experience, is anchored by this very direct mantra. It's just move better, hurt less, perform more.
I love how simple that is. So the mission for our deep dive today is to explore the profound difference between what the source material calls retail guesswork and, actual clinical foot care.
Because there is a massive difference there.
Huge. We're going to look at how prioritizing the health of your feet impacts literally everything.
Okay.
From, say, your lateral quickness on a pickleball court to whether you can actually enjoy your evening after a grueling 12-hour warehouse shift.
Right.
But for you listening, I think we need to clarify what a certified pedorthist actually does first. Because I feel like a lot of people immediately default to, well, a podiatrist or just that clerk with the foot measuring thing at a retail shoe store.
Yeah, and that distinction is really the cornerstone of understanding this entire practice. So a podiatrist is a medical doctor, right? They perform surgeries, they prescribe medications for foot diseases.
Okay.
But a certified pedorthist is an expert in the actual biomechanics of the lower extremities. So they specialize in using footwear, which means shoes, physical modifications, custom-built orthotics to correct mechanical problems in the foot and the lower limb.
Got it. So it's very specialized.
Highly specialized. I mean, this isn't about stepping on one of those digital pressure pads in a pharmacy aisle and buying a, generic gel insert off the rack. It is a dedicated clinical intervention.
Which sounds intense, but the material mentions this clinic operates on a cash-based model.
Yes, which is huge. There is no insurance maze to navigate. No doctor's referral is required at all. You literally just book an evaluation and get really fast access to care with fully transparent pricing.
Honestly, that transparency removes a massive barrier, especially for people who are just so used to the anxiety of hidden medical bills showing up months later.
Oh, totally. It's a breath of fresh air.
But I want to push back on the premise here just a little bit on behalf of everyone listening.
Okay, go for it.
Store-bought insoles are incredibly cheap, and they are immediate. Like you buy them, you slide them into your sneakers, and you feel that squishy cushion right away.
You do feel it right away, yeah.
So is going this intensive clinical route really necessary for just the average person with sore feet? Or is this reserved for, extreme medical anomalies?
So what's fascinating here is how the clinic's own educational guide, it's called The Difference That Protects Your Feet, by the way, which you can download on their site as this 1.4 megabyte Word doc. It completely dismantles the illusion of that immediate, squishy comfort.
Oh, really? How so?
Well, if we look at the underlying logic, generic drugstore solutions have to assume that you have a generic foot. They are mass-produced to fit the mathematical average of millions of different people.
Right, they're trying to fit everybody at once.
Exactly. But nobody actually has a generic foot. Every single foot has a unique arch, a unique strike pattern, and its own unique pathology. So when you buy a cheap foam insole, you are really just temporarily masking the pain with padding. You aren't correcting the mechanical misalignment at all.
So the foundation of the house is still tilted. You just bought like a softer rug to walk on.
Precisely. That is exactly it. And what happens when you do that? Over a few weeks, that generic cushion just compresses under your body weight.
Oh yeah, they always go flat so fast.
Right. And once they go flat, the mechanical misalignment persists and the pain travels right back up the kinetic chain.
And just to clarify for everyone, the kinetic chain is basically just a biomechanical way of saying your joints are a series of stacked links, right?
Yeah. Your ankle connects to your knee, which connects to your hip, which connects directly to your lower back.
So it's all connected.
Entirely. If your foot rolls too far inward when you walk, your tibia twists. And that twist throws your knee out of alignment, which then tips your pelvis.
Wow, just from a slight foot roll.
Yeah. Clinical pedorthic care acknowledges that, hey, your left foot might actually need an entirely different degree of support than your right foot just to balance that chain. It's about real structural correction, not just shock absorption.
That mechanical breakdown makes it pretty obvious why a retail shoe store clerk, whose primary metric is just sales volume, can't solve a kinetic chain issue.
They just don't have the training for it.
Right. So let's look at how Michael L. Ashley actually does this in practice. The source material outlines this three-step precision alignment process.
Yeah, so step one is the clinical assessment. This is a very comprehensive evaluation of your feet, your natural gait, your specific pain patterns, and this is very important, an analysis of your current footwear.
The objective is to map out exactly how your body interacts with the ground before they even prescribe a fix.
Exactly.
But, okay, here's where it gets really interesting to me. Evaluating someone's gait makes total sense, but evaluating their old, worn-out shoes, I mean, it's just crushed foam and rubber.
It sounds strange at first, yeah.
Right. How does looking at a beat-up pair of sneakers tell a pedorthist what's wrong with a patient's body?
Because worn-out footwear basically acts as a permanent topographical map of your biomechanics.
Oh, wow. Like a footprint frozen in time.
Yes. By looking at exactly where the tread is worn down, a skilled pedorthist can read the story of how your foot strikes the earth thousands of times a day.
Okay, that makes sense.
For instance, if the tread is heavily worn on the inside edge of the sole, it reveals overpronation, meaning the foot is rolling way too far inward and the arch is collapsing.
And what if it's on the outside?
If the wear is entirely on the outside edge, it indicates supination, which means the foot is too rigid and it's rolling outward. The shoe documents these tiny asymmetries that the patient can't even feel happening.
You know, that actually reminds me of dealing with a bad suspension in a car.
Oh, that's a good comparison.
Because buying a generic insole for foot pain is honestly like replacing your tires because they're wearing out unevenly, but completely ignoring the bent axle that is destroying the tires in the first place.
Yes.
The pedorthist is essentially the master mechanic looking at the uneven wear on the tread to diagnose that bent axle.
That is exactly how the physics work here. The shoe tells the mechanic what the chassis is doing, and once that assessment is complete, we move to step 2, which is the custom solution plan.
So this isn't just pulling a pre-made box from a stockroom.
Not at all. This is designing a totally personalized roadmap. It might involve engineering precision-built custom orthotics, selecting specific footwear with, say, the right torsional rigidity, or even mapping out structural modifications to the shoes themselves.
Which leads right into step 3. Precision fit and follow-up.
Right, which is where the science actually meets the pavement. Because you can design the perfect orthotic on paper, but step 3 ensures the device, the footwear, and your body's mechanics actually work in perfect harmony.
So it's not just a handoff.
No, it involves building, fitting, and physically fine-tuning the orthotics. It's an ongoing process of adjustments to guarantee lasting mechanical support.
And while this clinic is physically located in Cedar Hill, and they serve local places like DeSoto and Lancaster, the source material explicitly details these national pedorthic services.
Which is such a great resource.
It really is. They offer virtual pedorthic consultations and a national custom orthotic mail order program, meaning You don't actually have to be a local Texas resident to escape the retail guessing game.
And expanding access through remote guidance is just essential for a highly specialized field like this. The core methodology remains exactly the same, whether you're in the physical clinic or doing a virtual consultation.
You assess the mechanics, plan the intervention, and fine-tune the outcome.
Exactly.
So now that we understand the mechanics of the clinical process, let's look at who actually benefits from it. Because the material breaks down very specific daily missions, starting with high-performance athletes.
Yeah, the athletic applications are incredibly tailored. They provide targeted foot health strategies for runners, golfers, tennis players. And this is interesting. There's a massive emphasis on pickleball.
Oh, pickleball's everywhere right now.
It really is. And it's highly logical to focus on it given the explosion in popularity, combined with the fact that it requires aggressive, abrupt lateral movements.
Which a lot of people aren't ready for.
Exactly. Many older players just aren't biomechanically prepared for that kind of strain. The clinic even provides a pre-exercise pedorthic checklist to help these athletes identify red flags before a major injury occurs.
I noticed they also collaborated with the Boss Babe blog for a campaign called Step Like a Boss.
Yes, that's a great campaign.
And they offer an educational guide simply called Why Your Athletic Footwear Must Match Your Activity. And the focus there is on how wearing the wrong type of shoe for a specific sport actively invites injury.
And this goes right back to the kinetic chain we talked about earlier.
Right.
Think about it. The biomechanical demands of running forward in a straight line require a shoe that absorbs heel strike and promotes forward momentum. But if you wear that exact same running shoe to play pickleball or tennis, you are in serious trouble.
Because they aren't built for side-to-side movement.
Exactly. Running shoes lack lateral stability entirely. When you lunge side to side to hit a ball, the high, soft midsole of a running shoe can easily just roll right over, resulting in a severe ankle sprain.
Ouch. Yeah, that makes sense.
The pedorthic approach basically mandates that your structural equipment matches the physics of your activity.
That makes perfect sense for an athlete on a court. But the site dedicates an even larger section to occupational foot pain solutions. So we're talking about the workforce here.
The people on their feet all day.
Yeah, culinary professionals, retail and hospitality teams in Duncanville, warehouse workers, delivery drivers, tradespeople.
And perhaps most crucially, nurses and teachers.
Right. I mean, think about the teachers or healthcare workers, listening to this. So many of them just accept chronic foot and lower back pain as an unavoidable side effect of their career.
It's just seen as part of the job description?
Exactly. They work a 12-hour shift on concrete warehouse floors or like hard hospital tile. Their feet are screaming by hour 8, and they just resign themselves to it. Why do we accept that?
We shouldn't.
Does treating footwear as mandatory occupational safety equipment fundamentally change how we look at workplace fatigue?
Well, if we connect this to the bigger picture, treating footwear as clinical safety equipment changes the entire socioeconomic reality of a physically demanding job.
Wow, socioeconomic, how so?
The clinic highlights this by focusing on occupational mobility. When a nurse or an industrial worker is in agony, their physical productivity drops, their risk of secondary compensation injuries skyrockets, and their actual career longevity is severely threatened.
So it's not just about comfort, it's about livelihood.
Exactly. Proper biomechanical alignment means fewer lost wages from calling in sick with back spasms. It means a longer, more sustainable career. And most importantly, it means having the physical energy left over to actually engage with your family after you clock out, rather than just collapsing on the couch with an ice pack.
That really reframes the whole issue. It's not just about surviving your shift. It's about actually getting your life back when the shift is over.
Beautifully said.
And the clinic addresses this directly with their gold standard work fit package. It bundles hands-free, slip-resistant footwear with custom orthotics for $430, which, the site notes, actually saves the worker $150 compared to buying them separately.
Which is just a brilliant alignment of incentives, honestly.
Yeah, it seems super practical.
Because slip-resistant footwear is heavily mandated by OSHA in culinary and healthcare settings to prevent falls, right?
Yeah, you have to wear them.
But a generic slip-resistant shoe often provides literally zero arch support. So by fusing that mandatory slip resistance with clinical custom orthotics, they solve the employer's liability need and the employee's biomechanical need in one streamlined, heavily discounted package.
That's incredibly smart. So we've talked about athletes optimizing their game and workers surviving their shifts. But the clinical depth of this practice goes way beyond lifestyle and occupational support. The site outlines some really heavy, advanced medical interventions.
Yes, absolutely. The scope of medical practice here is extensive. They tackle conditions like plantar fasciitis, which for those who don't know is the inflammation of the thick band of tissue running right across the bottom of your foot.
Very painful, I've heard.
Excruciating. And they utilize a plantar fasciitis night splint for this.
Okay, wait, what does a night splint actually do? Why not just treat it during the day while you're walking?
It has everything to do with how the human body heals at rest. When you sleep, your foot naturally points downward, right?
Huh.
And when it points down, that inflamed fascial ligament contracts and it tightens up. So when you get out of bed in the morning and put your full weight on it, you are violently tearing that tightened tissue.
No, that sounds awful.
It is. That's what causes that sharp stabbing pain on your first morning step. So the night splint holds the foot at a rigid 90-degree angle while you sleep. It keeps the fascia gently stretched so it actually heals in an elongated position.
That is a perfect example of treating the mechanics of the body rather than just, icing the heel and hoping for the best.
Exactly.
They also list treatments for bunions, hammer toes, and these conditions called hallux limitus and hallux rigidus.
Hallux rigidus is actually a fantastic example of the kinetic chain in absolute distress.
Really? What is it?
It literally translates to a stiff big toe, and it's usually caused by arthritis in the main joint. During a normal walking gait, your big toe needs to bend upward so you can properly push off the ground.
Makes sense.
But if that joint is frozen and rigid, you physically cannot push off, so your body unconsciously compensates by swinging your entire leg outward just to clear the ground.
Which instantly throws your knee and your hip completely out of whack.
Exactly. And a pedorthist treats this by designing footwear with a rigid sole and a specialized curve at the front. It's called a rocker bottom.
A rocker bottom.
Yeah, it mechanically rolls the foot forward as you walk, entirely bypassing the need for the big toe to bend at all. You restore the normal walking gait and instantly relieve the strain on the hip and knee.
That is fascinating. Then there is an incredibly prominent focus on diabetic foot protection. They offer diabetic socks, seamless slippers, and this specialized item called the diabetic neuropathy gauntlet.
Diabetic foot care is arguably the most high-stakes service a pedorthist can provide.
Because of the nerve damage.
Yes. A common complication of diabetes is neuropathy, which is severe nerve damage that just eliminates the ability to feel pain in the extremities. A patient with neuropathy could step on a piece of glass or have a poorly fitted shoe rub a really deep blister on their heel, and they will feel absolutely nothing.
That is terrifying.
It is. And because diabetes also restricts blood flow, that unfelt blister can rapidly deteriorate into a severe ulcer, gangrene, and ultimately amputation.
Which means perfectly fitted, seamless footwear isn't just about comfort for a diabetic patient.
Yeah.
It's essentially armor.
It is a critical medical necessity, period. And this ties directly into the clinic's focus on advanced Charcot foot stabilization.
I saw that term in the material. What exactly is a Charcot foot?
Charcot foot is a devastating complication where neuropathy basically meets biomechanical failure. Because the patient cannot feel their feet, they just continue to walk on minor stress fractures.
Oh, no.
Yeah. Over time, the bones in the midfoot literally shatter and collapse, creating what is known as a rocker bottom deformity. The foot loses its structural integrity completely.
So how do you even treat that?
The pedorthic intervention here requires highly advanced, custom-molded bracing and footwear designed to completely offload pressure from those collapsed bones. It stabilizes the limb, and it prevents the severe ulcerations that lead to amputation.
So what does this all mean? When you look at the full spectrum of this practice offering, like pickleball injury prevention on one side and life-saving Charcot foot stabilization on the other, it feels incredibly vast.
It is a very wide spectrum of care.
But they anchor all of this with local DFW community wellness initiatives, which I loved. They are actively collaborating with walking clubs, senior centers, and churches in Southwest Dallas to bring foot health education directly to the public.
Which really reflects an understanding that healthcare doesn't just happen inside a sterile clinic building.
Right.
By going into senior centers and churches, they are delivering preventative education to vulnerable populations before a catastrophic breakdown even occurs. And they take it a step further by directly addressing one of the most paralyzing hidden barriers in the whole healthcare system.
You mean transportation?
Transportation.
That really stood out to me on the contact page. They state explicitly that if patients lack transportation to the Cedar Hill Clinic, they can utilize Star Transit. Like they even provide the number 877-631-5278 to schedule a ride directly to their appointment.
Because you can design the most advanced diabetic orthotic in the entire world, But if an elderly patient with severe neuropathy cannot physically get to your building,
Huh?
your expertise is functionally useless to them.
Wow. Yeah, that's entirely true.
By integrating a service like Star Transit into their patient intake process, the clinic actively dismantles those logistical barriers to care. Preserving a patient's physical mobility is just inherently tied to preserving their independence, their mental health, and their dignity.
It is a phenomenal bridge between high-end biomechanical science and actual on-the-ground neighborhood-level elder care.
It absolutely is.
Well, we have covered a massive amount of ground on this deep dive. We started by tearing down the myth that generic, store-bought insoles can magically fix complex kinetic chain issues.
Goodbye, drugstore gel inserts.
Seriously. Then we walked through Michael L. Ashley's meticulous three-step clinical process. Diagnosing the wear patterns on your old shoes, designing a custom structural plan, and fine-tuning the fit for lasting alignment.
It's all about the
It
mechanics.
really is. And we saw how this specialized science scales across society, from keeping athletes agile to providing the gold standard work fit package that saves workers $150 while protecting their career longevity, all the way to engineering life-saving interventions for diabetic patients facing bone collapse.
Which brings up a really crucial takeaway, I think.
Yeah, what's that?
Well, this raises an important question for you to explore on your own. Our feet are the only 2 points of physical contact we have with the earth. They dictate the alignment of every single joint above them.
The foundation of the house.
Exactly. Why then do we so often treat our footwear as just a disposable fashion accessory rather than the most crucial pieces of medical equipment we interact with every single day? Next time you lace up your shoes, ask yourself, are you just putting a temporary Band-Aid on a crumbling foundation, or are you actively supporting your future mobility?